Hi, I'm Laura. I am a certified lymphedema therapist, and today I wanted to talk to you about some of the basic explanations of exactly what lymphedema is, because it's kind of a confusing topic. So just at its most basic level, lymphedema is a collection of fluid in a particular part of the body. And it's not just fluid, which is what makes lymphedema different than any other kind of swelling. It's fluid with a high collection of protein in it. And that is really what makes lymphedema different, because the protein itself collects water. Anytime that there's extra protein in a specific area of the body that isn't being processed correctly, that protein attracts water. The protein is also very irritating to the tissues around it, so it causes this inflammatory process. And in lymphedema, when you have that inflammatory process going on for months, years, or more, you end up having some pretty significant changes to the skin, one of which is the formation of what we call fibrotic tissue or fibrosis. It's a stiffening of the tissue, and you'll especially see that in fingers and toes, where you can't quite lift the tissue up as easily as you normally would be able to because of that irritation. It also causes the skin to stretch almost to an unlimited size. So as the fluid increases and the protein increases, the limb will just continuously grow in size because the skin just keeps stretching, and eventually folds will be created for extra space. So that's all kind of linked back to the fact that there's so much protein in that space. This protein in the fluid is actually in an area called the interstitial space, which kind of means the space in between the cells or in between the structures in the body. And a lot of people will ask me, well, can't we just take a needle and stick it in there and aspirate the fluid just like you would if you had fluid in your knee or fluid in your shoulder? The doctor will aspirate it. With lymphedema, because the fluid is so widespread in that interstitial space, if you put the needle in and tried to aspirate it, you wouldn't really be able to get at it because it's so widely spread through the tissues, which is why we have to do the specific complete decongestive therapy, and I'll get to that in another video because it's a little bit more complicated. But going on with exactly what lymphedema is, when we have that fluid and we have that protein, we divide it into two different types depending on what it's caused by. The primary type of lymphedema means that you were born with a lymphatic system that either didn't have enough vessels or didn't have enough lymph nodes, or just the structure of how your lymphatic system worked wasn't sufficient to move the fluid and other issues and other materials that your lymphatic system moves. So you have a collection of fluid. It might be in your leg, it might be in your arm, it can be really a lot of different places. But these are people who it's congenital. They were born with it. Sometimes it doesn't show up immediately after birth. For some people it starts right away. But for other people it can take maybe 10, 15 years before it actually kicks in. And sometimes it's aggravated by an injury. If you already had a compromised lymphatic system, even if you didn't know it, you might sprain your ankle, and then that extra fluid will start that process of lymphedema coming in. So that's the primary lymphedema. We don't see quite as much of that as the secondary lymphedema. And secondary lymphedema is caused by a change in the lymphatic system, usually something that causes damage. And this can be a surgery, it can be an injury. Most of the time what we see secondary lymphedema from is cancer treatment. So things like chemotherapy and radiation therapy are very harsh on the body, especially radiation therapy. And our lymphatic system is really delicate. So if you have several radiation treatments that are targeted at a lymph node area, or that work through an area where fluid is drained, say out of the arm or out of the leg, then the damage to that area of the lymphatic system will cause lymphedema down the leg or down the arm. And that's primarily what we see in the United States or in developed countries. There's another form of secondary lymphedema that's not really common around here that is caused by a parasite. It's called filariasis, where in tropical countries you'll get bitten by a mosquito, and that mosquito puts the parasite into your body, and it takes several years, but that parasite actually grows in the lymphatic system. And when it grows in the lymphatic system, it cuts off the circulation. So you'll see a lot of lymphedema down the legs because the circulation just isn't able to get rid of that fluid from your lymphatic system. And that's a big problem in tropical countries. A lot of issues with that in India and Africa and things like that. And they don't have the medical system that we have here, and they don't have the professionals that are trained to treat lymphedema like we have here. So it's much more difficult for them to get treatment. And for that reason, we'll see people go all the way to the 4th stage of lymphedema, which is elephantiasis, where the limb gets really big. There's a lot of complications with skin conditions. So it gets really complicated when it goes that far into the progression. But primarily what we see in the United States is the secondary lymphedema caused from cancer treatment. So how is lymphedema diagnosed? And how do we know the difference between swelling from another condition or swelling from lymphedema? And that it gets to a little bit of a gray area. A lot of that is dependent on what your medical history is. So we know if you went through radiation treatment and then you start to have swelling in the arm, chances are that's lymphedema. But if you haven't had cancer treatment and you start to get swelling somewhere, we try to rule out other things. Make sure it's not a blood clot. Make sure that you don't have any kind of venous or arterial issues, that it's not a circulatory system problem in terms of blood flow, that there isn't a heart condition, because sometimes congestive heart failure and things like that will cause swelling in the extremities. So we start to rule those things out. And then we start to look for certain symptoms. Specifically, there's a test called the Stemmer sign, and we always look for that. And it's you just pinch the skin on the top of the finger or on the top of the toe and see how easy it is for you to lift that tissue up. And if you feel like it's stiff or it starts to get squared off around the sides and it feels very fibrotic or thick, then that's a positive Stemmer sign, meaning that we know that there's protein in there with that fluid, and the protein is causing the skin to become aggravated and start to become fibrotic. So the Stemmer sign is really a definitive way of knowing that that's a lymphedema case. The other thing that we look for is the buffalo hump formation. This can come from other kinds of swelling, but it's just kind of another thing that we say, okay, they have the buffalo hump. And what this is a large collection of fluid either on the back of the hand or on the top of the foot. You'll have this really pronounced hump of fluid on the top of the foot or on the top of the hand. The other things that we look for are a history of any kind of skin infection. So that could be cellulitis, it might be a fungal infection, especially with the feet. You'll be more prone to getting things like athlete's foot, toenail infections, but any kind of condition of the skin where we know that that's coming from a compromised lymphatic system, because your lymphatic system is so important in immune function. Once the lymphatic system is compromised, then the immune system isn't able to fight off things like cellulitis infections and fungal infections. So you'll see that a lot more. We also do just some palpation, which just means feeling the area. See what it feels like, what the skin texture feels like, what the color is like, the surface of the skin, seeing what that feels like, if there's any give to the tissue or if it feels really stiff and fibrotic, and that gives us some information to know whether it's lymphedema or whether it's a different kind of swelling. We also take some measurements to see if the swelling is changing over time, if it's getting larger, or if there's a fluctuation up and down, and that gives us some information to know exactly what's going on. But the biggest thing I feel like is the history. So when somebody comes into me and they say, oh, I've had cancer treatment and now my leg is swelling or now my arm is swelling, we know pretty sure that that is a secondary lymphedema from the cancer treatment. So once lymphedema is diagnosed, there's a very predictable stage system that it will go through. Now, what's not predictable is how quickly you progress from one stage to another. It's totally different depending on the person, depending on how compromised the lymphatic system is. It also depends on how well their venous and arterial system is functioning, because that's the other component of fluid movement in our body. If your veins and your arteries are really healthy and they're doing a good job, then the lymphedema probably won't progress as quickly because there's not as much stress on your lymphatic system. If your venous and arterial system is compromised, if you have any kind of issues with that, it puts more lymphatic load on your lymphatic system. It's working harder, and therefore it's more likely to break down. So let's talk about the stages of lymphedema and how it actually progresses once you have it. The first stage is the latency stage, and basically the latency stage means that there's been some kind of an injury to your lymphatic system, and it might be from cancer treatment, it might be from surgery. Radiation is a big one. If you know you've had radiation to a specific area, it probably did some damage to the lymphatic system. And we know that there is a higher risk of developing lymphedema, but there aren't outright symptoms just yet. And you can stay in the latency stage for 10, 15, 20 years, maybe even forever after you've had cancer treatment, because there's no guarantee that you'll definitely get lymphedema. It just means that you're at a higher risk. Some people in the latency stage might have the common symptoms of lymphedema, which is just a heavy feeling or an achy feeling. Not really pain or anything quite that severe, but just kind of an odd heaviness to the limb. And that would definitely constitute being in the latency stage, as long as we don't have a change in circumference just yet. We know that there isn't a large collection of fluid or protein at that point. So then, from the latency stage, if you end up progressing into stage 1, we call it the variable stage. And this is where it can be a little bit trickier to diagnose that it is lymphedema for sure, especially in the legs, because this is where the circumference of the limb will get greater and smaller during the day, depending on your activity level, depending on your position, depending on how well hydrated you are. All those things kind of come into play. And you'll see sometimes the swelling is worse, sometimes it's a little better. So some people in that stage are like, well, you know, if I do certain things, then I can manage it and it'll be okay. With the legs, a lot of times people will just elevate their legs, it gets a little bit better, and then during the day it gets a little bit worse. So they kind of manage it that way. But at that point is really the critical time to start treatment, because we don't have any fibrotic changes in the skin yet. We haven't had the protein in there long enough to cause really bad inflammation, so this is the best time to start treatment in the stage 1 in the latency stage. If we can jump on it at that point, then we know we won't get those complicating factors that come in the second and the third stage. So a lot of people do end up ignoring it in the latency stage in stage 1, so if that happens, then over a period of time, it's different for everybody, but over a certain period of time, you'll definitely progress to stage 2. And in stage 2, we call this the chronic stage, and this is where the fluid is collecting more and more, and it doesn't have that variability of increasing and decreasing in size. The size is only gradually increasing, and there's a higher collection of protein in there, so we know that we're getting more and more inflammation in there. And the skin is starting to get a little bit more rigidity, because that protein is causing inflammation. So we don't have the pitting like we do sometimes in stage 1. You'll be able to push your finger and create an indent in the skin. Stage 2, we have more firmness. You can't really dent the fluid that well. That also tells us that the fluid is going to be more difficult to move when we start doing treatment for it. So that's why we try to avoid getting into stage 2. If we can avoid that, it makes treatment much faster, much easier. So now, if you're in stage 2, and you start to notice that you're getting skin changes and inflammation, there's all sorts of skin changes that will happen. The texture of the skin will get kind of scaly sometimes. It will probably start to get some cellulitic infections. You might start to have, especially in the feet, more frequent like athlete's foot, toenail infections, skin fungal infections, things like that, especially in between the toes. So that's something to watch for, and definitely needs to be treated quickly, because it can get rather bad since the lymphatic system isn't able to help with that immune function as much as it normally would. So you really need to keep an eye on the infections and do meticulous skin care at that point. Now, if stage 2 is not treated, then it can progress to stage 3, which is elephantiasis. And you can look online to see some pictures of that if you'd like. But there's really no limit to how large that limb can get. If there's a lot of damage to the lymphatic system and the fluid exchange is really poor, the limb can get really, really quite large. And because of that protein concentration and the ability for that protein to help the skin to stretch and become very fibrotic, you get these folds, and we call them lobules of skin that just kind of cascade down the limb, and there's usually a fold around the ankle so that the skin will start to drape down over the foot. Now, each of those folds are places where moisture and bacteria are going to collect. So the combination of having a decreased immune system and then having these places, these crevices where bacteria and moisture can collect is kind of a recipe for infection. And that can really become an issue. We can start to have skin breakdown in those spaces, and you have to keep a really close eye on those. Now the good thing is that even if you have someone who progresses to this third stage of lymphedema and they have that elephantiasis, most frequently that you'll find this in undeveloped countries, and specifically people who have had filariasis, the infection from having that mosquito bite and being infected with that parasite, then you'll see somebody who hasn't been able to get medical attention for probably years and have progressed to this point. But the good news really is that you can still treat it. It's a longer process to treat. It's more challenging because the fibrosis limits the movement of the protein in the water, so you have to fight against that. You're also going to need a lot more wrapping materials because the limb is just larger, and that can be rather expensive, but it can still be treated, which is the good part. Some of the things that you want to watch for, especially in this stage 3, you will definitely have things like keratosis, which is a keratin type of substance that starts to grow from the skin. Think of like fingernails. You start to get these little growths of what feels like fingernails. It becomes very bumpy and very rough. You can get what's called peau d'orange, which is skin that looks like the peel of an orange with those little dimples and ridges in it. And that's a sign of inflammation from the protein and the fluid in there. You'll also start to get, at the end stages in 2 and 3, you'll start to get a reflux of the lymphatic fluid where it's so tight and there's so much fluid in that area that it starts to push out through the skin. And you'll have this crust that forms on the skin, and you'll see it's kind of a whitish yellow color. And it will come out from the skin and sometimes dry on the skin. You'll see dried lymphatic fluid. And that's when you know that there is a large amount of pressure in that limb and the fluid just doesn't have anywhere to go. It's being pushed out through the skin. So that's really when you're at a critical point where treatment needs to happen. So I think that pretty much covers everything in terms of what lymphedema is and where it comes from, what causes it, and the stages that it progresses through. If you have been through some kind of surgery or chemotherapy or radiation therapy, that puts you into this latency stage where your lymphatic system somewhere in your body might be compromised. I think the take-home message is just know what the symptoms are, watch for that heavy, aching kind of feeling, because if you start to have those, then you definitely want to start to do some treatment, whether it's wearing a compression garment, doing manual lymphatic drainage, some of the things that we'll talk about later in terms of treatment. Getting on it as early as possible so that it's much easier to treat when you get on it early. Alright, thank you so much. I'll have another video on the treatment aspects coming up.